Hey everyone, welcome back to all my listeners. It's a brand new season here at the podcast. It's also a brand new year. Welcome to year 5 for Paint the Medical Picture podcast. This is season 16, episode 1. Today is Wednesday, September 3rd, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. So I just wanted to thank all of you, my loyal listeners around the world, here in the United States, Canada, everywhere. I am so happy to see your continued listenership grow month after month, year after year. I do this because I'm simply passionate about the work I do in healthcare, in the business of healthcare, as well as in the education of this really, really niche area of healthcare. So I'm just so happy. Big shout outs to all of my loyal supporters, friends, and colleagues around the country that I've been working with for over 15 years now. And, I am just so happy that we are in conversations all the time. We see each other face to face at conferences. We see each other face to face on the webinars that we provide, education that we deliver. So hats off to all of you as well and all of your accomplishments. So I'm simply happy to start off a new season, a new year with a bang. So lots going on for Paint the Medical Picture podcast that we will be rolling out as the months go by. But I'm very, very happy. And I wanted to start the podcast off with some good news. So anyways, you guys, today's Newsworthy is going to be featuring, again, another spotlight. It is the month of September, right? So I hope you all enjoyed a very good Labor Day weekend, enjoyed some time off. Hopefully you guys did have a long weekend and you took that extra day or all 3 or all 4 days to get away, escape, and take that much needed vacation somewhere. So today's Newsworthy is going to be featuring my spotlight on one of the many, many healthcare awareness subjects for this month of September. But today I'm going to be focusing on Childhood Cancer Awareness Month. And in my trusty tip, I'm going to be focusing on the latest scrutiny on our evaluation and management codes, especially those higher level 4 and 5 codes. Cigna has a new policy that may be taking effect on October 1st, 2025. So that's just 1 month away. And the new season's Spark will be changed up as well. So I'm going to go ahead and close out today's episode with a remarkable quote on resilience from Shane Koyczan. All right, you guys, let's get into it. So today's Newsworthy. September is Childhood Cancer Awareness Month. This month is a time to increase pediatric cancer awareness, support families facing childhood cancer, and inspire funding for research, prevention, diagnosis, treatment, and support. Here are some facts on childhood cancer from St. Jude Children's Research Hospital, a leader in advancing cures for childhood cancer in the U.S. and around the world. On average, more than 290 children and adolescents in the U.S. are diagnosed with cancer every week. About 90% of children with cancer live in low and middle income countries where they lack access to adequate diagnosis and treatment. Most of these children will die from their disease. Worldwide, about 400,000 children and adolescents develop cancer each year. Only half of these children's diseases are diagnosed. Pediatric cancers are rare, complex diseases that may develop at any age from before birth through the late teens. Now, here are known pediatric cancers, or types of childhood and adolescent cancers. Acute lymphoblastic leukemia, or ALL. Adrenocortical tumor. Astrocytoma. Brain and spinal cord tumors. Choroid plexus tumor. Craniopharyngioma. Diffuse intrinsic pontine glioma. Ependyoma. Ganglioglioma. Germ cell tumor, extracranial. gliomatosis cerebri, acute myeloid leukemia or AML, anaplastic large cell lymphoma, atypical teratoid or rhabdoid tumor, Burkitt lymphoma, chronic myeloid leukemia or CML, differentiated thyroid cancer, diffuse large B-cell lymphoma, Ewing sarcoma, germ cell brain tumors, giant cell tumor of bone and soft tissue, high-grade glioma, Hodgkin lymphoma, juvenile myelomonocytic leukemia, low-grade glioma, lymphoma, medulloblastoma, neuroblastoma, oligodendroglioma, osteosarcoma, primary mediastinal large B-cell lymphoma, retinoblastoma, thyroid nodules and cancer, infant acute lymphoblastic leukemia, kidney tumors, liver cancer, lymphoblastic lymphoma, medullary thyroid cancer, melanoma, non-Hodgkin's lymphoma, optic pathway glioma, pineoblastoma, relapsed refractory acute lymphoblastic leukemia, and soft tissue sarcoma. And now it's time for my best practice tips in Trusty Tip. Now, there's a lot of discussion that's been going around regarding another policy update that Cigna is trying to put into effect. Now, this is for a commercial reimbursement policy that is slated to go into effect on October 1st, 2025. Now, this policy was last updated on July 1st, 2025. The annual review date for this policy is next up on October 1st, 2026. And this is specifically reimbursement policy number R49. Now, when you look closely at this policy, which is available to everybody online, now in this red text at the very top, it says, quote, notification, effective October 1st, 2025, Cigna has developed a new reimbursement policy. Cigna may adjust the E&M CPT code 99204 through 99205, 99214 through 99215, and 99244 through 99245 to a single level lower when the encounter criteria on the claim does not support the higher level E&M CPT code reported, end quote. So in other words, the only codes that are affected or will soon be affected are level 4 and level 5 new and established patient office visits, as well as level 4 and level 5 consultation codes. Now, these are the moderate and high levels of medical decision making, or MDM, or codes that, if based on time, are 45 or 60 minutes for new patient 99204 and 99205 respectively, or 30 minutes and 40 minutes for established patient 99214 and 99215 respectively, and finally for 40 minutes and 55 minutes for consultation codes 99244 and 99245 respectively. Now, this entire policy that I've read through again and again does not address time. How can it when it states they will be downcoding by one level if the claim does not appear to justify or support the complexity of the visit? The claim reflects the diagnosis codes. Again, just an opinion by the payer, Cigna here, right? That the diagnosis or the diagnoses do not support the complexity of the E&M code. Again, the claim says nothing about time if time is being used. So again, that's just my opinion when I read this entire policy over and over again. Now, again, they have the ability with this policy that may go into effect on October 1st to downcode by one level without any documentation being reviewed. So let me read a little bit more. Quote, their reimbursement policy. Quote, Cigna will reimburse claims for professional services submitted in accordance with coding and documentation guidelines established by the AMA within the current procedural terminology, or CPT, evaluation and management coding guidelines, and guidelines around additional services provided at the time of the encounter. Providers are also expected to adhere to the ICD-10-CM coding guidelines when identifying a diagnosis for the treatment of a condition. Cigna may adjust the E&M CPT code 99204 through 99205, 99214 through 99215, 99244 through 99245 to a single level lower when the encounter criteria on the claim does not support the higher level E&M CPT code reported. For example, a claim may be adjusted as follows: a 99215 down to a 99214, or a 99214 down to a 99213. Now, this is the part that I've highlighted on my multiple copies of this PDF that I've saved to my computer. When a code level has been adjusted and subsequently medical records are submitted that substantiate the complexity and medical decision-making MDM or time associated with the reported E&M CPT code level, the code will be reimbursed at the level initially submitted. So that's a really striking sentence to me that I have highlighted and I wanted to share with my audience. Because in my opinion, along with so many others in the industry, including the AMA, the Texas Medical Association, the California Medical Association, and many others, submitting post-payment appeals with complete documentation is an overly burdensome process, negating the very purpose of the 2021-2023 E&M guidelines that were set forth by the AMA, right? Less burden on our already overwhelmed providers. So I think this policy, if it does go into effect, is going to have a very, very burdensome and negative effect on our providers. But of course, in the meantime, as I've always stressed on the podcast for years, in the meantime, as we stay tuned for what's in store for us on October 1st, right? Will the policy stay or will it go? Will it stay or will it go? My trusty tips for MDM always are about provider documentation should always support the guidelines. And the guidelines I'm talking about are for 2021 and 2023 today, right? So for MDM today, we have to have documentation that supports three things, right? The number and complexity of the problem addressed during the encounter. Number two, the amount and or complexity of the data reviewed and analyzed during the encounter. And finally, number three, the risk of complications and or morbidity or mortality of patient management. And then, of course, my trusty tips for documentation, if using time, are always going to be about details. And those details should always include things like how much time did it take you to prepare to see the patient, right? In terms of how long were you reviewing those tests. Details should also include obtaining and or reviewing separately obtained histories and physical examinations. Details should also include time on counseling and educating patient, family, caregiver that was performed by the provider only. And again, in that specific one for counseling, please remove the percentages that are part of the old, outdated guidelines from 1995 and 1997, right? There's that little 50% or more time was spent counseling, right? We want to see exact time, please. How much time exactly were you spending counseling and educating? Moving on, we also need to see details on the ordering of medications, tests, and procedures, right? How much time did it take for you to do that? Also, the referring to and communication with other healthcare providers, right? When those things are not being separately reported, you can count that time. You need to document that in the medical record. You can also include documenting clinical information in the medical record on the day of the encounter. So if you're taking notes for the encounter before the exam happens or at the end of your day. But again, it has to be on the date of service. You can be typing up your notes either in the early morning, late at night, or while you're in the exam room with the patient, but it has to be on that date of service. And then also, if you are independently interpreting results and communicating them to the patient or the caregiver on the same day as the patient encounter, include that time as well. And then finally, care coordination that is not being separately reported with another CPT code, and it has to be specifically performed by the provider. All of those things can be documented to support time as well. So in the meantime, as we stay tuned for October 1st, what is Cigna going to be doing? All of these Trusty tips we should be implementing, right? Our notes for E&M services that are level 4 and level 5 for new patient established and for consultation codes, we should be supporting everything in our findings in our documentation. It doesn't do the provider any good if all of that information is not trickled down from the gray matter up in their wonderful brains, all of their intelligence, right? It has to be brought down into the notes. And so when those things are going to be audited by a payer, which inevitably things will be audited by a payer, we want that to be well supported. So hopefully the Cigna policy will not take effect because there's been plenty of blowback, pushback over these past few months since the policy was drafted. There's been a lot of pushback. So hopefully the petitions, the people's voices will be heard, and the policy will simply go away, will be put away, hidden away, and it will just be their regular and standard evaluation and management policy, not this one, which is very, very punitive and simply downcoding just based on a claims perspective without even taking any documentation into consideration and making providers and practices jump through hoops by filing post-payment appeals and submitting documentation afterwards. So hopefully this reimbursement policy goes away. I am not a fan of it. So many others in the industry are not fans either. So just wanted to give you guys my trusty tips on this big, big item that has been circling about. So I wanted to talk about it also. So I hope you guys got a lot out of it, and keep all of these trusty tips in mind, especially for MDM and for time for our evaluation and management codes. And finally, I focus season 16 Spark on resilience. I want this 16th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires us with their statements involving resilience. So in this week's inspiring quote in Spark is from Shane Koyczan. If your heart is broken, make art with the pieces. Absolutely true, right? Why not? This quote reminds us that we can always do something after defeat, after heartache, after rejection. This quote reminds us we can create something fresh, something better. I'm happy Shane Koyczan's spark still burns brightly and can inspire so very many. All right, you guys. Well, I hope you enjoyed today's episode. There are so many more healthcare spotlights that I hope to share with you guys in the month of September. And I really do hope you enjoyed yet another evaluation and management trusty tip that I provided. I know I've provided quite a few in the recent weeks, but there's so much going on in the news, and there's so much that our providers can do to just implement better documentation practices, to protect their practices, to avoid continued scrutiny from the various payers. So anyways, you guys, thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.